The broadcast is now starting. All attendees are in listen-only mode.
Hi, I'm Rajgopal, Client Solutions Manager, and I will be hosting this webinar today. First of all, I would like to give a warm welcome to you all from Nous Infosystems. And I would like to introduce my presenter for the day, Shammy Narayanan. Shammy heads our healthcare practice at Nous, and he's the business unit head for healthcare practice. And I would like to, I would like to set some ground rules for this webinar today. Please type in your questions into the question panel of the GoToWebinar, which you can see in the right corner of your screen. Questions will be answered at the end of the webinar. Audience will be kept on mute during the webinar, and webinar recording and deck will be shared once after this webinar is over. Uh, I would like to pass on this mic to Shammy Narayanan without any further delay. Shammy, over to you.
Thank you, Raj. Good morning, good evening to all of you wherever you are, and welcome to this session on the healthcare world in the new artificial intelligence ecosystem. This is a very hot topic which is happening around us, and I really feel glad that all of us are here together today to discuss about what is happening, right? So, even before we deep dive into this session, so I want to take you down in a memory lane on 1970s and 80s. During this time frame, it was considered as a boom in the aviation sector, and there was discussions like the borders of the economic activity are becoming thinner, the e-commerce and the commerce world was increasing, and travel was radically getting reimagined. So fundamentally, the business was supposed to increase. The number of people who are going to use the aircrafts were supposed to go up. But actually, what really happened is during this time frame, the aviation sector recorded the highest number of crashes. And this is a statistics which we could easily see from the public domain. So after each of this crash, there was a committee which was formed. People were sitting together. They were trying to analyze what is really going wrong, and they were trying to put some protocols and to restrict or to avoid a future crash. And all this was increasing the overhead. As the overhead was going up, the cost was also on the rise. As the cost was on the rise, travel was becoming less affordable to a common man. So fundamentally, what was happening is the adoption rate was going down. So this was like a ripple effect, one feeding into the another. There's a crash happening, people sitting together to discuss, then they keep adding a protocol. This protocol increases the overhead cost. The overhead cost again brings up the cost of flying. So people were actually getting discouraged from taking the aircrafts. I'm not trying to say that there was no one who was going to fly, but the numbers were not spiking up as what we could have really imagined and the hype which was created. So, what was fundamentally going wrong here? So, that is when people sat together to analyze and to discuss, is that a problem with the technology or is it a problem with the strategy? And we figured out when we change the approach from a pilot centric to a passenger centric approach, things might change. They wanted to give a try, and that was a very fair trial, right? And here is the result. So today, if you see the statistics, right from 1980 till last year, the number of crashes were going down and down and down. And last year was a phenomenal year because 2017, in the history of aviation, there was zero jet crash record. So that means this change in the strategy worked, and it really worked well. Now, when this particular things happen, right, the protocols through towards the passenger centric strategy also brought down the cost. So when more people started flying in, more people started entering into the business, so it became affordable to the common man. So there was one shift which tilted the whole game from a pilot centric to passenger centric, and that is exactly what the healthcare world needs today. Today, there are lots and lots of blogs written, speeches given, conferences arranged, wherein we all talk about the spiraling cost of healthcare. US, we are talking about the GDP consumption by healthcare is on the record high. So we want to bring it down. Doesn't it, this story resonate very well with what we have seen in the aviation sector? So do we need a technology to bring this change, or do we need an approach to bring this change? The answer is simple. It is an approach. We need to change the approach from a doctor-centric strategy to a patient-centric strategy. But how we do it? We do it with the help of AI. So AI by itself, let me make it abundantly clear, is not going to change anything. It is one more technology which is just going to be an enabler. But how we position AI in the broader scheme of things, that is going to change the whole game for us. It is going to make life easier. It is going to bring down the cost. It is going to restore the peace at the dining table. That is important. Bringing back the smiles to the faces, right? Now you will have questions. Okay, this is all good. We have seen it. We had been hearing it in various conferences. How we are going to do it? Or is it something like we are just going to try? Do we have some proven use cases behind it? There will be a lot of questions which will be sprouting up in your mind at this point. And here I am going to present 5 use cases which we have done in Nous, which we have supported our customers, and we have seen there is a change. And some of the use cases may not be direct from Nous, but we have also seen they are changing the way the healthcare is being conducted, right? So we wanted to take the best of the best and present it here. It doesn't mean these are the only 5 cases. We can help you and support you with more, but due to the paucity of time, I want to restrict it with 5, right? So let's get on to the first case, inpatient experience. So this is going to be something which I believe all of us, including me, we can relate to. In our lifetime, each one of us would have gone to a doctor's office, either for us or for our loved ones or for our friends, right? And there is a delay until you see your doctor. You would have set up an appointment. Your appointment would have been at 11. So you would have thought like, okay, I'm going to return back at 12. You would have taken a half a day permission from your office. You have reached the doctor's office at 10:30 sharp. You'll be sitting there, sitting there, sitting there. It's an excruciating pain because you don't know when your turn will come. And remember, it is not like the doctor is intentionally making you delayed. He might have got just pulled into an emergency case, or he would have just he would have arrived late because an operation took longer than expected. But you cannot walk away. You never know when you will get your next appointment. So you have to sit there. Sitting there, can you play a Justin Bieber music and may have fun? Absolutely not. You know that hospital has a different set of rules than your coffee launch. So you need to wait. You need to wait. And you don't have a lot of things which you can do at your disposal. This is an experience which I believe everyone in this webinar, everyone who is hearing me now at this moment would have experienced at least once in your life, right? I know that many people are nodding your head, which I could see it here virtually, right? Now, can AI change this? Yes, and the answer is a thumping yes. The reason why I say that is AI-based system can radically redefine this experience from a doctor-centric to a patient-centric. Even before I tell you how do I do it, if you have a question saying that, hey, this is once in a time, why do you want to change it? Is it really necessary? I want to give you some statistics. So that is when we went to the Harvard Medical School and we dig the report of 2015. It is there in the public domain for every one of us to see. It says on an average, a patient spends 121 minutes in a hospital, out of which 64 minutes is waiting time. That means more than 50% of your time you spend in an hospital is not for seeing the doctor, but actually you are waiting for the doctor, right? So in terms of cost, that means average person loses $43 of cost just for waiting, while as an average cost for getting the consulting itself is $32. So even the mathematics supports this, saying that yes, this is a use case which is worth taking. Let us redefine it. So what do we do? Did we do something really bombastic? Really, did we do something like wherein we have to build in a lot of systems, complicated, complex, convoluted systems? No, we don't do all those things. It's a very straightforward approach. wherein every hospital has already all your patient records. It knows from where you are coming in. It also knows on an average this particular doctor what is his consultation time. It also knows when this doctor has arrived on that day, right? So based on all this, by triggering few APIs, it can tell you that, hey, you know what? 2 o'clock you have an appointment with doctor. Normally you would have started at 1. Given the traffic from your home to the hospital, I can tell you that don't start at 1. The doctor is late, so I will suggest you to start at 3 o'clock so that you can visit the doctor at 4. Now you need not wait here in the hospital lounge. You can be there at home or office. Your permission need not be converted into a leave. I know that many people will have difficulty dealing with your HR in getting that leave approved, right? So let's get on to the next case. Now, slightly, let's build this complication, right? Because now we saw a very, very simple use case. Now, let's get on to a case of optical coherence tomography, a groundbreaking innovation which just came in few years back, which helps us to get a 360-degree view of your retina in a non-invasive way. It is changing the way a retina scan is being done. So, what is happening? If you take the streets of London, in the last 5 years, there are so many optical shops which have come in, wherein a person can go and say, hey, you know what? I see I have a itching in my eye. I have a irritation in my eye. Can you just take a scan? Yes, good. They take a scan. Now what happens? This scan has more information than what a normal ophthalmologist can comprehend. So fundamentally now he sees that, hey, there looks to be a slight deviation. I don't know. I couldn't explain this deviation. You better go to the NHS and get it re-examined, right? It is better to say that I don't know and ask the person to go. So what's wrong with it? Where does AI come in? Now, this type of patients who go and get enrolled in NHS to re-examine, last year it was 9 million. 9 million patients. Isn't it a good thing? Absolutely good thing. But what happens is it impacts certain people who need immediate priority. For people who are above 50, they get an infection called AMD, which means age muscular degeneration. There are two types of AMD, wet and dry. Wet AMD means within 48 hours, if you don't attend to, there is a high possibility they may become blind or partially blind. Now, this person goes and stands in that line of 9 million outpatient. And several of them who are ahead in the line may just have false positives. Nothing is wrong, but because the ophthalmologist felt you go ahead and re-examine, he's there ahead of you in the curve. So you may get your appointment probably 7 days down the line or even 1 month down the line. Can it wait? Definitely no. By the time this person will become blind, his life is at risk, right? And then what happens? We have to spend a lot of healthcare dollars to bring him back to the stable condition. That is how the whole healthcare system cost goes up. Now, what AI can do here? What AI can do here is absolutely phenomenal. It will read all your scans using machine language and say that this particular cases looks okay. This particular cases looks to be of little bit high priority. Let me rearrange it. And then this person who in the first in first out order would have got his appointment 7 days later now will be placed first in the line. Now, without doing a lot of changes, just by having a change in your scheduling system, we are able to give back the vision to the right person. And that is AI for you, right? And by doing this, we are restoring peace. We are restoring the happiness of a person who is already in his 50s, who really needs the vision at that point of time. I'm not trying to say a person below less than 50 doesn't need a vision, but they need it because they are enjoying their retired life. Correct? So that is what AI does that for you. And the process by which it does, we call technically as reinforcement learning, where it learns on itself, right? I'm not going to get too much of the technical details right now. I will restrict myself to the more business application of it, right? And I have a similar scenario, which was recently reported in Tokyo's Institute of Medical Science, wherein a patient was diagnosed by the doctors with acute myeloid leukemia, a type of blood cancer. So what they did, They immediately gave her all the type of treatment which was the best available for that particular cancer, and then they were waiting to see how is the recovery, how is the response of this person. Their expectation was, okay, the response would be like the person will becoming healthier and healthier with each passing day. But actually what they observed was little different. The person was becoming weaker. Was this treatment not good? Not exactly, because the expert opinion says that was the best treatment available for that cancer, and for this treatment they should have got a best response. With the best treatment they got a poor response, so there was something fundamentally going wrong. So what they did, they took all the reports, fed into a cloud based artificial intelligence system called Watson, right? And immediately it analyzed it and said, this particular patient's DNA has had 1,000 genetic mutation. Did it stop there? Did it just say that, hey, you know what, it has mutation? It didn't do that. It just went one step ahead and said, out of this 1,000, these are hereditary ones and these are diagnostically essential ones. So you pay attention here. It also pointed out this person had another type of cancer which was growing, which was not detected. Now they were able to immediately respond to that diagnosis and was able to restore the health of the patient within weeks. Now you may ask this question, do you think doctors cannot do it? We are not trying to undermine the expertise of human intelligence or the doctors who had been spending selfless hours in caring for the patients. However, to do this manually, it would have taken at least weeks. Watson did it in 10 minutes. So don't see it's a AI versus human. You see AI is complementing, supplementing human effort in restoring the health of a patient. So this is not like a chess game which we are playing against one another, but we are all working in collaboration. Is this collaboration necessary? Why is this even necessary? The answer is in the statistics. WHO suggests we need to have the doctors to patient ratio. So for every 100 patient, you need to have one doctor. But there is no country in this whole globe where this statistics is met. From where I come from, India, we have 1 is to 2000. So fundamentally, I don't see in the next 10 years we'll be able to bridge this gap. So we need technology. And when the technology helps us, nothing like that. It is phenomenal, right? So now we are getting onto a stage wherein AI is able to read the genes, and if it can relate the genes to the disease and the type of response, we will be getting in a different world of personalized medicine. So what does it mean is, today you get a headache, you get a common cold, you have a pain, you go to the pharmacy, you get a medicine which even your neighbor will be getting it. That medicine is not made for you and you alone, but sooner you will have a medicine made for your genes, your type of response, the type of disease you have got. And that is AI for us. So when you can have a shirt which was tailor made for you, when you can have your own hairstyle, why don't a medicine which will take in and help you to recover better? Why to take a generic medicine? That's a thought which AI is able to plant in right today, right? So with all this, what's happening is the cost goes down. So by detecting the cancer early, by detecting your wet AMD early, we are able to address it in the initial stages. So the overall cost goes down. When the overall cost goes down, it becomes affordable to a common man. When it is becoming affordable to common man, most people get enrolled. Now I believe you will be able to relate it to the aviation story. It is a ripple effect, one feeding into the other, right? Now let's take another controversial example, because I'm not here to just say AI is all the best solution. I want to present facts as a fact. So back in 1985, there was an experiment which was conducted wherein this is called as Tarak 25, wherein we wanted to see how AI machines behave in curing cancer. So there were patients who were classified in two types, and they were said that, okay, for patient A, the type A, we'll be giving the radiation at low intensity. For type B, high intensity radiation in a very protected mode will be given. We wanted to see who recovers faster and quicker, right? Unfortunately, some user interface bugs and some deployment bugs made the low intensity beams to become high intense beams. So unfortunately, a type 1 cancer got aggravated to type 3 because now they were getting high intensity radiation. So we have cases wherein AI has failed us. I'm not going to deny it. In the last 10 years, 144 lives were lost. Around 1,300 people got injured because of AI. When I say the machines which are powered by artificial intelligence. Now the question is, oh, that's a big number. 144 people losing life is not something which we can take it in a lighter way. So should I stop everything in AI? Should I not go ahead? Those type of questions will rise in your mind. So there are constraints which I'm anyhow going to cover as we get more into the latest topics. But to let you know, I will also give you another number. In US alone last year, 100,000 people died in hospitals due to the bad human care. And this is another number which you can go directly to Google and take it up. So when I say around the globe, in 10 years, 144 people have lost lives due to AI. And in one country alone, you have lost 100,000 people due to the bad human care. This number of AI pays completely. So that means, yes, it is evolving. It has flaws. It is not absolute, but that doesn't mean we need to just stop that. It has a potential. It has a potential, and it comparatively it outperforms human, right? So this is a case of a hospital chain based out of East Coast. So what they did 2 years back, they brought in AI powered systems. So AI powered systems to do, or AI powered robots to do all your knee replacement surgeries. So what did happen? Without increasing even a single doctor or a paramedic in their team, within a year, they were able to show 40% improvement in efficiency. So what is that? What was a magic wand with this robots brought in? They made smaller incision, so the blood loss was less, the recovery time was faster. So inpatient surgery became an outpatient surgery. This person parks his car, brings his assistant, gets there, gets the kneecap replaced, then drives back to home. A single day, similar to your cataract operation. So your cost of the bed and other things, right? Hospitalization is totally eliminated, and then you have a happy patient. He need not spend days or weeks in hospital. He can go, and you can use that bandwidth to service more and more people. That is how, without increasing a single doctor, they were able to service 40% more in one single year. And this is a case which is happening today as we speak. Probably at this point of time, there is someone who is getting operated in this hospital, replacing his kneecap and bringing back his smile, saying that now I'll go and play the golf. Now I'll go and play. I'll hit the home run, right? That is the type of confidence which we are able to bring in their recovery time, right? I know that many of all the scenarios which I've been talking about is on individual care. AI can also do a community care. For example, Ebola outbreak or a tuberculosis outbreak. What happens is all these are infectious diseases. It can spread faster. So before AI, what we used to do is we used to go ahead and we used to immediately take the patients into a separate area, cordon that area, and give them treatment. But at somewhere that disease keeps spreading. The community is getting infected more and more and more. Now, what happens with AI? AI is able to identify the strain from, and it also is able to identify the place of origin, saying that, okay, now this particular outbreak is happening. From where did this strain originate from? Now it also alerts and says, go ahead and block movements from that area. Stop that people from moving around and give them the preventive care or corrective care so that outbreak is stopped right in the initial stage. And this system is very much available even today in New Jersey, wherein if a person is identified with the tuberculosis, they not only address him, but also will be able to relate, saying that from which county this particular would have started. and then they will be able to inform the health department there to go and scan everyone in the neighborhood to ensure there is no outbreak. That is how AI is able to help us in a very subtle but a very powerful way, right? I know that many of you who are in this webinar will be wondering, saying that, hey, all this is good. I love this, but I am taking care of applications. I'm building applications, I'm testing applications, I'm maintaining applications. How can AI help me, if at all? Do you have an answer? Yes. For that question, I have an answer. AI can help you in a process called verification, which technically we call as testing. You may say that, what's so great about testing? I have a phenomenal team who is doing a greatest job on the earth. I have been deploying systems after systems for the last 1 decade. So now what AI can do there? In fact, Soviets thought the same thing, and the Europeans also thought the same thing when they launched a particular spacecraft to go and land in Mars, right? And that was in year 1988. Europe did it in 1996 when they launched a spacecraft when they wanted to study the magnetosphere, and all this is there in public domain. After putting a lot of effort on testing, after spending hundreds of millions on this testing, this spacecraft aborted before landing on Mars. You know why? Any guess? It's simple. That software was missing an hyphen, and because that hyphen was missed, it gave a end of mission command even before the spacecraft landed. So every system got auto shut down and it burst. Same thing happened with Europe, wherein a buggy software which couldn't manipulate a 16-digit number made the system to go out. If this is the case with a spacecraft, what about a system which is going to save your life, which is going to help in the research of your drugs, which you are going to take, which is going to help a community, generation after generation, right? That needs to be thoroughly tested. So in today's system, we have limitations in the number of cases which we can test with a lower bandwidth and a lower timeline, because always we are driven with the go-to market strategy, right? Now what happens is, in AI-powered system, which we will be able to do all the mission critical application testing in a much better way. So am I speculating? Absolutely not. So there is an operating system called SE4, which was thoroughly tested by AI with all possible permutations and combinations, so that it is guaranteed this operating system will never ever hang. Can you guarantee that for iOS or Windows? Not today, right? So this is improving. So it has gone to a stage wherein you put an application in a cloud. A AI bot will come in, will do a complete testing, will give you a report card saying that from a user experience standpoint, this is where your particular app is standing. It will rank, and it will allow your human bandwidth to be focused on solving a problem rather than detecting a problem. And these are again not speculations. These are there available today. So you can use your testing team in a much better way to focus on the critical path, on those things which are essential, rather than retesting something which was already established. Leave that job to AI. Leave that job to AI to create more data, test data, to combine, to form your test strategy, to identify scenarios. AI bots, again with the reinforcement learning, supervised learning, unsupervised learning, it can do for you, right? So having come to the tail end of the webinar, and let me make it clear, I'm not saying AI is a magic pill. I'm not trying to say that go home in peace and rest in peace. AI will do everything for you. It's not a magic pill. You have to remember 10 years back when someone told us a computer can do a 16-digit multiplication much faster than a human, we were surprised. But the same computer took 10 years to recognize a human face, which normally we do it in seconds. So what is easy for human being is not easy for AI, and what is easy for AI is not easy for human being. So we need to operate on our strengths. Today's ecosystem is not fully developed. There are organizations which has failed in doing a POC on AI. They are still they are trying to attempt it again. We know that there are constraints. As what you see in mainframe and Java, you will not see so many people who are expertise with AI. there is a lack of human expertise available now because AI is still on the top of the hype curve. Regulatory mandates are not established fully. So if a self-driven car goes and meets with an accident, who has to be sued? Is the owner of the car, or the manufacturer of the car, or the car itself? You never know. So there are regulatory mandates. Ecosystem is not ready. A hospital can have a AI powered system, but the interfacing subsystems or the vendors or the contractor, they may not have AI powered systems. So fundamentally, we see that there is imbalances, there are challenges, there are questions, and these are real. We need to face it. Because of this, can we just skip AI? No, this ship we cannot afford to miss, because it creates a unique customer experience. It brings down your cost. It helps you to rebrand yourself and gets closer and closer to your end user, your customer. And it does it like never before, like no other technology has ever done in the history, right? So um, I will say we have to take this with a pinch of salt, and we shouldn't consider AI as a cure for everything. But it is in that journey, and the journey has begun. And Nous can support you in enabling this journey in whichever stage you are. Maybe you are just thinking about AI, or you are already in the path of AI, or you may want a second opinion on AI. We have been there, we have done that, we have done it for many of our customers across the verticals. And there are successful use cases, successful collaborations, which we'll be happy and glad to walk you through. Once again, thank you for attending this webinar. It was a very nice interaction. Now let's get on to the questionnaire. Any questions, feel free. I see that my friend Rajagopal already has few questions with him. Let me take few of them. If at all the numbers are more, we assure you that we will be getting back to you in the form of emails. But be assured you will be answered and we will stay connected. Thank you.
Hey, thanks, Shammy, for an interesting and informative session on AI in healthcare space. I would like to take this time before getting into the question and answer session. I would like to briefly introduce about us, Nous Infosystems. Uh, we are a global IT services provider with over 2 decades of experience providing application development, maintenance, product engineering services, independent testing, and infrastructure support services across enterprise and independent software vendors alike. So our technology expertise has helped us deliver innovative solutions in key verticals such as banking and financial services, education, retail logistics, and of course, healthcare space. And we have skilled workforce of 1,000+ employees across the globe, and we work on various engagement models, and we have 350+ satisfied customers worldwide. And we have established a center of excellences across various disruptive technologies such as Microsoft, DevOps, mobility, UI, UX, big data and analytics, and so on. And coming to the healthcare focus on from Nous Infosystems, as a leading healthcare technology company, we provide technical and operational solutions to various categories of customers in the healthcare continuum, like payers, providers, and pharma and CROs. And we have helped and assisted many companies across the globe from the compliances and technology services and solutions and coding and standards as well. With this, I would like to take few question and answers. I would like to request Shammy to answer some of the questions from various audiences. Due to the limit of time, we will take few questions online now, and we will respond to you via email later after this webinar. We will go with the first question here. I am from a hospital, so where do we start journey on this AI?
That's a very interesting question. And in fact, hospitals are the places wherein you have a direct access to the patients, right? So the first and foremost thought is, before you get on to the AI journey, you need to think about a strategy. You need to identify the customer touch points And then you need to formulate a strategy saying that, okay, these are the touch points and these are the pain areas, and this is how I want a strategy to reduce the pain area. How we are going to do it is the next part, but what you want is the first step. Because the ROI questions, right? And once you have deployed an AI, you will be able to answer in a very convincing way once you have known the exact pain area. For example, I had been telling you in the first use case wherein a patient is waiting on an average 40 minutes in your hospital. Can I bring it down by 50%? That is going to be a phenomenal success. So fundamentally, that also means you can service more and more patients. So can that be your potential AI area? So first identify all the patient touch points, then define a broader strategy. And the next step is, okay, now here, what technology can do. So don't follow technology, make technology work for us. So that will be the starting step, right?
Okay. So the next question is, what are the investments required for this?
The investments, it will be like, as I said, data is the biggest challenge when it comes to AI. Most of the time identifying an algorithm or putting together a certain piece of code is not the real challenge which can be done, but do you have the right verifiable data which is clean? So collecting data, having a data strategy in place is important. What data you are going to collect, for how long you're going to collect, how we are going to archive and de-archive it, what type of investments you're going to bring in, because all data cannot be stored in cloud, especially in the healthcare world, wherein you have certain mandates, right? So what type of storage which you are going to invest in, and how the data governance policies is going to be there. So those are the first thing which comes to my mind. And number two, it is always better to have a CDO, which I call as a chief data officer, similar to a CIO. And so the relationship can differ. Who reports to him? I'm not getting to get into those nitty gritties. That is for a different day altogether. But invest in data, understand your data clearly, and you might also need to know which data you want to procure from outside. Certain data we need to get from the government sites, certain data you might need to get from your community centers, so, and social media data, because you might even want to know what is the perception about your hospital or your service in the society. So you might need to even get those data. You need to mingle it together to form a meaningful analysis, but doing that is the easiest part. Getting the data is the most toughest part. So focus on your data.
Hey Shami, the right time you touched on the data, I think. Here is the next question. Is there enough data available for the AI based models to give accurate data?
Yes and no. Um, there are countries, there are places, there are organizations which have been taken an early bird advantage. They have invested in data, they have collected it, they have failed, but they have got up and they have succeeded. So yes, there are cases, say for example, Kaiser Permanente, IBM Watson is there operational, wherein they are doing few things based on the AI systems. The Tokyo Institute, which we just covered, also they are successful using AI systems. But every hospital is not. So fundamentally, as I said, there are hospitals, there are clinics which are catching up, which they are in different stages of POCs. They are even thinking about POCs. So those, I will say it's a mix, and which is expected. When any new technology comes into market, there will be apprehensions. And that too, in the last 4 years, there had been a myriad of technology which was hitting us. We are talking about blockchain, we are talking about IoT, we are talking about machine learning, we are talking about AR, VR, or augmented reality, virtual reality. Now, people are at a loss. If so many things are coming, is it a hype? Should we wait and see? So obviously, with all those different strategies and approaches in place around the globe, wherever we have seen from now, we are seeing that it is a mixed reaction. So that doesn't mean we need to stop, but it means that we need to acknowledge and continue.
Hey, thanks, Shami. There are a few more questions. Due to the limit of time, we will take it offline and we will respond to you via email. Feel free to type in your questions if you have any further to the email addresses mentioned in the slides at info@nousinfo.com. Thanks a lot once again for taking your time and joining us for the interesting webinar today. Thanks once again and have a wonderful day. Bye.